This CSCS mock test includes 25 practice questions to help you prepare for your CITB Health, Safety and Environment exam. Listen carefully, pause when the timer appears, and choose your answer. Make sure to keep note of any you get wrong so you can review them at the end. Question 1. If the safety guidance from your initial site induction seems outdated because the work has changed, what is the best step to take? A. Create new safety instructions yourself to match the current tasks. B. Stop work and talk to your supervisor about your concerns regarding the rules. C. Ask your co-workers what new rules they are following. D. Continue working because you are not officially responsible for updating safety documents. The correct answer is B. Stop work and talk to your supervisor about your concerns regarding the rules. Question 2. If equipment you're using has been issued a prohibition notice, what action is required? A. You can continue using the equipment but must be supervised. B. You may not use the equipment until necessary repairs or safety measures have been implemented. C. Only highly trained supervisors are allowed to use the equipment. D. You can finish your current task and then stop using it. The correct answer is B. You may not use the equipment until necessary repairs or safety measures have been implemented. Question 3. What is the primary legal duty placed upon all workers under the Health and Safety at Work Act? A. To be responsible only for their own tasks and ignore general safety. B. To purchase and maintain their own personal protective equipment. C. To comply with safety duties placed upon all people at work. D. To write a new risk assessment for every task they undertake. The correct answer is C. To comply with safety duties placed upon all people at work. Question 4. As a construction worker, which of these is explicitly not part of your legal duty on site? A. Looking after the health and safety of others affected by your actions. B. Reporting any defective equipment you find. C. Never misusing safety equipment provided for protection. D. Writing and preparing official site risk assessments. The correct answer is D. Writing and preparing official site risk assessments. Question 5. A method statement for a task should detail 3 essential areas of planning. Which 3 apply? A. The materials, tools, and equipment needed. B. The site directions and local amenities. C. The sequence and correct way the work should be completed. D. The competency levels and required training for the personnel involved. The correct answers are A, C, and D. Question 6. If you discover that you cannot perform a job exactly as detailed in the method statement, what must you do? A. Adjust the work method yourself to make it safe. B. Ask your colleagues what they think the best way to do the job is. C. Do not start the work until you have consulted your supervisor. D. Call the health and safety executive for guidance. The correct answer is C. Do not start the work until you have consulted your supervisor. Question 7. What is a toolbox talk? A. A lengthy seminar detailing the company's full safety policy. B. A sales presentation given by equipment suppliers. C. A short training session focused on a single safety topic. D. A detailed report issued by the site manager every Monday morning. The correct answer is C. A short training session focused on a single safety topic. Question 8. What is the significance of reporting a near-miss incident on site? A. It is legally required under the CDM regulations for all incidents. B. The main goal is to learn from the event so you can prevent a future injury or accident. C. The main goal is to find someone to blame for the potential problem. D. It helps satisfy the requirements of the site's insurance policy. The correct answer is B. The main goal is to learn from the event so you can prevent a future injury or accident. Question 9. If you are injured at work, which type of accidents must be recorded in the official accident book? A. Only injuries that require a visit to the hospital. B. All accidents that result in any form of injury. C. Only major injuries such as a broken bone. D. Only accidents that involve expensive damage to machinery. The correct answer is B. All accidents that result in any form of injury. Question 10. Which of these personal identifiers is not required to be recorded in the site accident book? A. The injured person's home address. B. The nature and details of the injury sustained. C. The date and time the incident occurred. D. The injured person's national insurance number. The correct answer is D. The injured person's national insurance number. Question 11. If a worker is injured and the details are recorded in the accident book, what is the mandatory retention requirement for this confidential record? A. It must be destroyed once the injured person returns to work. B. It must be kept in a public place for anyone to read. C. It must be retained as confidential for a minimum of 3 years under the Data Protection Act. D. It must be sent directly to the employer's insurance company immediately. The correct answer is C. It must be retained as confidential for a minimum of 3 years under the Data Protection Act. Question 12. If your doctor confirms you have contracted Weil's disease due to your work, why must you inform your employer? A. Your employer needs to warn all colleagues to avoid you. B. The employer must report this type of occupational illness to the health and safety executive. C. The worksite will be closed down immediately due to the disease risk. D. The employer will arrange a replacement doctor for you. The correct answer is B. The employer must report this type of occupational illness to the health and safety executive. Question 13. If you're involved in a dangerous incident on site where no one was injured, a dangerous occurrence, who should you report this information to first? A. The client who owns the project. B. The health and safety executive. C. Your immediate site supervisor or the site manager. D. The entire workforce. The correct answer is C. Your immediate site supervisor or the site manager. Question 14. If you are told that you have hand-arm vibration syndrome from your doctor, what should your next action be? A. Keep the information secret to avoid getting into trouble. B. Inform your site supervisor or employer immediately. C. Only tell your close workmates. D. Assume it is not a serious condition and carry on working. The correct answer is B. Inform your site supervisor or employer immediately. Question 15. What item should absolutely not be included in a standard construction site first aid box? A. Standard bandages and dressings. B. Safety pins and wound closure strips. C. Prescription medication or over-the-counter painkillers. D. Disposable plasters. The correct answer is C. Prescription medication or over-the-counter painkillers. Question 16. Is an employer legally required to provide a first aid box on a construction site? A. Yes, all construction sites must have at least one first aid box. B. No, only if the site employs more than 50 people. C. No, there is no legal duty to provide first aid equipment. D. Yes, but only if the work involves hazardous materials. The correct answer is A. Yes, all construction sites must have at least one first aid box. Question 17. When must eyewash solutions or bottles be supplied on a work site? A. Only if the site is near a public road. B. On any site where there is a possibility that materials or debris could enter a person's eyes. C. Only when the weather is extremely hot and dry. D. Only on demolition sites involving asbestos removal. The correct answer is B. On any site where there is a possibility that materials or debris could enter a person's eyes. Question 18. What is the most important step you must take before approaching an injured person? A. Ask the injured person what happened to them. B. Move the injured person to a more comfortable spot. C. Always check the surrounding area to ensure you are not in danger. D. Immediately tell your supervisor about the incident. The correct answer is C. Always check the surrounding area to ensure you are not in danger. Question 19. If you find someone lying unconscious after a fall, what is the immediate priority after checking the area is safe? A. Try to make them sit up straight. B. Slap their face to try and wake them up. C. Contact the emergency services to send for medical help. D. Give them mouth-to-mouth resuscitation immediately. The correct answer is C. Contact the emergency services to send for medical help. Question 20. If someone has a large, deep splinter in their hand and is in pain, what should you ensure happens? A. Use a sharp object like a knife to dig the splinter out. B. Tell them to ignore it and let the splinter come out on its own. C. Tightly squeeze the hand to force the splinter out. D. Ensure they receive proper first aid for the injury. The correct answer is D. Ensure they receive proper first aid for the injury. Question 21. A worker has accidentally got a nail embedded in their foot. If you are not a first aider, why must you not attempt to remove the nail? A. The nail proves they were not wearing the correct safety boots. B. The nail itself may be helping to control and reduce blood loss. C. Removing the nail allows air and bacteria into the wound. D. The nail is keeping their boot firmly in place. The correct answer is B. The nail itself may be helping to control and reduce blood loss. Question 22. What is the recommended immediate treatment for a severe burn on a worker's hand? A. Rubbing barrier cream or Vaseline into the burn area. B. Wrapping the burn tightly in a clean handkerchief. C. Placing the burned area under cold running water or in a cold bath. D. Instructing the person to keep moving their hand to exercise it. The correct answer is C. Placing the burned area under cold running water or in a cold bath. Question 23. If you discover that the site wash facilities are always dirty or the toilets are not flushing, what is your correct action? A. Try to avoid using the site facilities until you get home. B. Try to fix the broken toilet yourself. C. Report the lack of hygiene or the fault to the person in charge of the site. D. Use the toilets in a nearby public cafe or pub instead. The correct answer is C. Report the lack of hygiene or the fault to the person in charge of the site. Question 24. Why should workers avoid using solvents like white spirit to clean their hands? A. Solvents are too expensive for everyday cleaning. B. Solvents carry harmful bacteria that attack the skin. C. Solvents remove the protective natural oils from the skin. D. Solvents block the pores of the skin, causing redness. The correct answer is C. Solvents remove the protective natural oils from the skin. Question 25. How does the bacteria that causes tetanus typically enter the human body from contaminated land or water? A. Through the nose when breathing. B. Through the mouth when eating or drinking. C. Through an open cut or broken skin barrier. D. Tetanus does not affect people, only animals. The correct answer is C. Through an open cut or broken skin barrier. Thanks for watching. If you're looking for a quick and simple way into construction, our Level 1 Health and Safety in a Construction Environment course will help you qualify from a home computer. Visit wardtraining.co.uk to get started today.